Insurance is a very complicated topic to talk about, especially health insurance, and I believe that understanding its functions is essential to knowing your benefits. In my profession, I work in a durable medical equipment company. I see examples of patients at a loss all the time when it comes to their care and not understanding the different types of coverage that there are. As of 2018, according to the U.S. Census Bureau, a little over 67% of the U.S. population has some type of coverage, and over 30% of them are on some type of public aid, be it Medicare or Medicaid. There are three basic types of insurance coverage, and knowing the difference between those types of coverage can mean all of the difference, and not just your coverage, but your ability to help others understand their own care. So I'm going to walk you through Medicare, Medicaid, and commercial insurance, so some people will call it private insurance. And I'm going to do this to help give you a better understanding of the concepts within, and it's going to be a very basic overlay of the concepts. So we're going to start with Medicare, which 44 million people in the United States, or around 15% of the population, are covered under. So Medicare is federal aid. It comes from the federal government, and about 80% of people, Medicare covers 80% of services. And typically Medicare is awarded to people over the age of 65. So anyone in the United States, when they turn 65, they're immediately eligible for Medicare and they can opt into those services. And some types of disabilities, people with disabilities are covered under Medicare as well, be it under or over the age of 65. So there are two types of services that Medicare covers. Part A and Part B. Part A covers inpatient services, things like hospitals and skilled nursing. Part B covers outpatient services. Two of the best examples I can think of, because I work in home health, is home health and durable medical equipment. So 93% of Medicare beneficiaries, according to the U.S. Census Bureau, do opt in for Medicare Part A and Part B. So a great example of this at OSF would be if a patient gets admitted for breathing problems to the hospital. Medicare Part A would cover for the inpatient stay services with the hospital staff and the doctors there, and Part B would cover the oxygen they would discharge with. Even when they're out of the hospital, Part B will still cover that. So I'm going to move on to Medicaid here. Medicaid is state aid, so it is coverage provided by the state government. 17.9% of the U.S. population is covered under this type of aid. Medicaid is typically awarded to the low-income population, or like with Medicare, lots of different types of disabilities are covered under this as well. So unlike Medicare, which covers at 80%, Medicaid will cover at 100% with no deductible or out-of-pocket cost at all. Because like I said, it is mainly to help low-income people. So it is, like I said, around 17.9% of the population, which is even more people than are covered under Medicare. So I'm going to move on to commercial insurance, and sometimes people will call this private insurance. And this type of insurance is it's paid for privately by the patient. So I'm going to take you through some of the concepts that come with commercial insurance that Medicare and Medicaid don't necessarily have to deal with. So I'm going to start with, is your insurance in network with your provider? So a lot of commercial and private insurance people don't really understand this concept. And the concept is your insurance company has a network with different types of providers. So a great example would be Humana is a insurance provided by OSF. So their insurance network has a lot of OSF providers on it. In fact, I think all OSF providers now as of 2020. So how this works is if your insurance is in network, you will receive normal coverage benefits, and I'm going to go over how this coverage works if you are in network. If the answer is no, you are not in network with the provider that you're using, you typically will have reduced coverage, and sometimes will even have no coverage. So the first concept, I'm going to go in order of importance. I'm going to start with the premium, and the premium is the monthly amount that the beneficiary pays to the insurance company to ensure coverage and services from that insurance company. This could be anywhere from $50, and I've seen premiums go all the way up to $500. It really just depends if you're paying for yourself or if you're paying for many other people on a plan. And so we're going to move on to copay here. Copay is a base amount paid for services that does not affect coverage whatsoever. This is if you show up at a doctor's office, you're going to pay around $20, and that does not affect any other type of services. It's an amount paid directly to the provider, and like I said, does not affect any type of deductible or your coinsurance rate or anything like that. So, moving on to the deductible, that's the amount paid before insurance will cover any services. This is a base amount that resets every year in in January. And this amount can be anywhere from, let's say, $100 all the way up to $2,500. And this is the amount that your insurance tracks, and you have to pay that full amount for services before your coinsurance rate will kick in. Now, when I move on to coinsurance rate, I want to make it clear there's a very big difference between your copay and your coinsurance rate. Your copay is a base rate that your provider will charge you. The coinsurance rate, that is the percentage of services that insurance will cover after the deductible is met. So let's say you have a deductible of $300 and you have a service of $500. You will be paying $300 of that out of your own pocket. Insurance will track that. Once you hit $300, your coinsurance rate will kick in, and let's say it's 80%. Now your insurance company will start paying 80% of that rate for the services, which will leave you with some left over. So moving on to the last concept I want to cover for commercial insurance is the out-of-pocket limit. Similar to the deductible, it is a preset limit by your insurance company, which is predetermined by your premium and how much you're willing to pay monthly. The out-of-pocket limit, once it is reached, insurance will cover 100% of all services. So let's say you've spent $2,500 on tracked services by your insurance company on the year, and that is your out-of-pocket limit. Once you hit that, your coinsurance rate will bump up from, let's say, 80% after your deductible is met, all the way up to 100%. And it is usually a very high amount for most insurance companies. I've seen anything from out-of-pocket being $1,000 all the way to $10,000, sometimes even higher, depending on what you're willing to pay for. So in conclusion, there's a lot of intricacies when it comes to health insurance, and it's vital to know what your specific type of coverage, be it Medicare, Medicaid, or private, and how they function, because with this information, I want you to be able to apply it not only to your own healthcare experience, but to those around you that may need your help navigating their coverage.